Hi, everybody. My name is Mark Swanziger. I'm from Oundle, England. I'm originally from America. When I was asked to talk about insurance, I'd fill up 10 minutes on talking on insurance. I said, no problem. I can talk 10 minutes on a form. But then it twisted to travel insurance, and I'm not really real well versed in travel insurance, actually. And unless you have one of these, this is a retired U.S. military ID card, where you're kind of covered for emergencies no matter where you go. But I don't see anybody in here that looks like they're young enough for me to put my recruitment pitch into. So I've done some research, and I've talked to a lot of people about travel insurance. And unfortunately, the news, when you have a pre-existing condition, is not great. Could I have the next slide, please? Well, what I'm going to cover the travel insurance, but then hopefully, that's not great news, but then I'm going to talk about healthcare insurance and some disability insurance and mortgage insurance, some other stuff that if you get the bad news on the travel insurance, maybe it's bad news, but you can turn that bad news into good news farther on down the road and then still try to fund your travel. So next. I went to the StaySure.com. I saw their commercial on television. I went to StaySure.com and I filled out the questionnaire to see if I qualified for travel insurance back to America. And they asked, "Do you have metastatic tumors?" I do. I've been through the stage where I had Y90 back in 2011. So the quality of life thing, I just want to hit on it. It's unbelievable. Yesterday I ran the British 10K, so you can't do that unless you're feeling halfway decent. So, but anyway, I ran a British 10K yesterday, but I don't qualify for travel insurance. Okay, so metastatic. I visit Professor Kaplan twice a year, and it's spread to other parts of the body. So the answer was, haven't considered your disclosures. No, we're not going to cover you. We'll cover you for everything that's not neuroendocrine related. So I hope nobody was looking for me to come up and give them the silver bullet on travel insurance. But there is some stuff I found out over the last 7 years on insurance that you might not know that you qualify for. Next. My personal insurance, my personal experience deals with NHS, private, and I've actually paid some cash for some treatments. If you knew what the cost of things are, it might not make it that scary. It's scary in America. It's the lanreotide shots, $4,000 or $5,000. You can't get lanreotide, but the Sandostatin shot in America is $4,000 or $5,000. Over here, it's about £1,000 for a month if you were to have to pay cash for it. So, and the same with the Y90 treatment. If you get down the road and you don't qualify for it, then you want to know how much it costs for cash, right? But you can get with me later on and I can help you with them numbers. Next, please. I've went on disability a few years ago. I punched out. The process is you start off on short-term disability. And the insurance policy I had was I had to stay on that for at least 26 weeks of not being able to work. I was exhausted. I couldn't concentrate. I worked as a defense contractor. If I made some mistakes in them computer systems, it was going to be catastrophic with real-world events. After the 26, you go on long-term disability for a couple years, and that usually drops you down to 66% of your base salary. But what I found out was the next step after you go on long-term disability is you have to file for a federal, in the U.S. it's Social Security. But when you go down through the cancers that qualify, secondary metastatic cancer in your liver puts you in a separate condition, and they don't question it as hard. So you might actually qualify for some disability insurance and you're not even aware of it. I wasn't aware of it. I probably could have stopped working about 6 years earlier. So next. That gets me to trying to get some money in your pocket to possibly cover cover your, oh, you're fine. to cover your travel experience, to cover expenses that travel insurance might not cover. This is what I put into my mortgage insurance claim. All I said was I have neuroendocrine cancer, inoperable metastatic spread to my liver, my back, my shoulder, my jaw, because that's what showed up on the gallium-68 scan. I suffer from extreme fatigue, and I have been approved by the U.S. Social Security for disability. It's incurable and it's inoperable, but I have not been given a prognosis. I've tried to ask Professor Kaplan that question before, but he doesn't give me an answer, and I don't want an answer. So I filled the form out and I sent it in. They tried to get a hold of Professor Kaplan to get the answer for the prognosis. He didn't give them an answer, but they approved it anyway. So, you know, it can help. You know, insurance is there. You pay for it for when it's a rainy day, and you know, it might not be raining, but it might be sprinkling a little bit. So do the research, fill the forms out, and they might actually approve it. So that's my spiel. Thank you.
Thank you.